somewhere, so thanks for joining us. I'm Jackie MacDonald Gibson, and I'm an associate professor in the Department of Environmental Sciences and Engineering here at UNC, and an affiliated faculty member with the Water Institute. And I'm really pleased today to introduce Laurel Firestone as our keynote theme speaker for today. She co-founded and co-directs the Community Water Center in California. And just last year, she was listed as one of the 9 most influential people in California water policy by Environment and Energy Publishing. So for someone so young, that is so impressive. She also has co-chaired the governor's drinking water stakeholder group in California for 2 years, from 2012 to 2014, and serves on a variety of state policy advisory committees. She also partners with universities to develop research and clinical programs to ensure the human right to water. She graduated with honors from Harvard Law School and holds a bachelor's in environmental studies, magna cum laude, from Brown. So with that, Laurel, thank you so much. Great.
All right, let's see, I think can you all hear me? Yes. All right, well, thanks for joining me here today after lunch. I am going to be talking about disparities in WASH. I think probably most of the people in this room, anyone working in the sector knows, has their own experiences with disparities. I'm going to be bringing in my experience in California and the work and perspective that we've been looking at these issues in California, and I'm hoping to have time, I should have plenty of time, to be hearing from you about what the similarities, differences, parallels are in other contexts as well. So last week I sat down with Tomas Garcia. He's one of our community partners and a leader in East Porterville. And he was recounting to us how his life drastically changed about 3 years ago when his daughter called out saying that the water had stopped in the shower. And little did he know then, but that was really the tip of the iceberg in what turned out to be tens of thousands of residents that were left without water at all in one of the worst droughts in history in California. 3 years of his life and many of his neighbors in East Porterville, as he was working to figure out emergency access, taking showers in church parking lots, helping to bring his small daughters to use the restroom and showers in the parking lot and the street down the street for before school, after work, and then working with his neighbors to try and organize a group to work on a long-term solution. Just this past year, finally, about 3 years later, was able to get water flowing into his tap and many of his neighbors in East Porterville from the neighboring city. And that community is pretty much all low income, Latino. Literally the main line for the city went through the middle of their street, but they'd never been connected. And before that, the drought hit and they were left without water at all, the majority of residents had domestic wells that had contaminants that exceeded primary drinking water standards. So there were water quality challenges far before that. And he's one of the many people that I've worked with over the past about 13 years now in California. Based in California is Central Valley, San Joaquin Valley. While the vast majority of communities in California have access to safe drinking water out of their tap, there are over 300 communities in California alone. That's just of the regulated systems that on a chronic basis aren't able to access safe drinking water. That includes schools, and that number doesn't count some of the many communities on private wells or without centralized infrastructure like East Porterville. So it may be surprising to you that California has so many communities and schools without access to what we would consider a basic human right. We've actually just this year got the state to put together this map tracking and mapping where there are systems without safe drinking water in the state. The red stars are those that aren't able to meet primary drinking water standards under the Safe Drinking Water Act in California. And the blue ones are the ones that are meeting it, and the light blue ones are ones that have been recently returned to compliance. This does not, again, count the some of the 2 million Californians that are on domestic wells that have both contamination and water supply challenges, as well as some of the newly regulated contaminants like chromium-6 and 1,2,3-TCP, trichloropropane. This actually doesn't count bacterial violations and some other contaminants like perchlorate. We estimate at the Community Water Center that more than 1 million residents in California alone don't have regular access to safe drinking water from their tap. A study by Carolina Balaz et al. In 2011 looked at arsenic and nitrate contamination and found that it disproportionately impacted low-income communities and Latino communities. There was higher concentrations of nitrate in the higher concentration of Latinos in communities, particularly in small communities like San Joaquin Valley. And there's also disproportionate impact in terms of economics. So our poorest communities are also paying some of the highest costs for water. Some residents are spending up to 10% of their household income on drinking water alone, between paying a water bill, often that doesn't meet primary drinking water standards, and then having to go buy and transport replacement water. This means often that many of our families turn to cheaper sources of beverages, like sugar-sweetened beverages, as well as lacking money for other basic necessities because they're having to spend it on drinking water. We've looked at schools. This issue in California impacts schools both in terms of the schools that are their own water system and therefore regulated as directly as a water system. Those are mostly in rural areas or outside of city boundaries, but also schools that are connected to community systems that don't meet drinking water standards. And we found there were more than 1,000 schools that were impacted by unsafe drinking water between 2003, 2014, and as many as 1 in 4 schools in the Central Valley. So for those that aren't familiar with California as much, that central part is called the Central Valley. It's really the kind of agricultural heartland. It's often called the Appalachia of the West. Very concentrated poverty, and some of the poorest counties and communities in our state. And you'll see in these maps from both the systems and schools and as I go through that there's always disproportionately a concentration in that area. But it's also important to note, and especially for our state policymakers, that this does impact the whole state. This is an issue that everyone should care about, but there are disparities in where the impacts are, both geographically, racially, economically. And another issue that we've worked on recently is unregulated contaminants. So we have been advocating for years to get regulation of 1,2,3-trichloropropane, which is an extremely potent carcinogen. It was used in pesticides in the 80s. It was it was discontinued in the 80s and deemed to be a potent carcinogen in the 90s, but it was known to be in drinking water since then, and it wasn't regulated until just this year, where they set one of the most stringent standards I think the most stringent standard in state history. And there are suits throughout the state now trying to hold Shell and Dow responsible for paying the costs for community water systems for treatment. It's still not clear who will pay for private, if we can get them to pay for private wells, and some of the state smalls that have more trouble getting access to legal counsel. But under products liability, there seems to be a good precedent that to get polluters to pay for safe drinking water access for this particular contaminant now that there's a regulated standard. In the drought, these are some of the wells that went dry. This was the voluntary reporting, so it's actually far more than this. This was just the ones that got recorded voluntarily through the county's system. But you can see, and let's see if I can point. This area is where we are based, really in the ground zero of the drinking water crisis in California. The communities on private wells are most vulnerable. They often have shallow groundwater. It may not have been adequately sealed or adequate infrastructure to begin with. There historically has been unregulated groundwater pumping in our area, so there's extreme overdraft, which means that the large agricultural operations are drilling deeper, especially with the drought, with lack of other water sources. We're pumping around the clock, and so our private wells that were shallower, the water level dropped in some cases 90 feet. I've heard of probably more than that in some areas, but I know of at least a few areas where there was just drastic dropping, and so thousands of wells went dry, including some community sources. So almost 12,000 Californians ran out of water. We don't have perfect information on this. This was Senora Magana. She was on a domestic well that went dry. And her husband was just recovering from heart surgery when this happened. He would take the truck out and go to neighbors, fill up buckets so that they could help be able to flush their toilet, use their evaporative cooler, which is the only cooling system they have for, and that's really common in our area. It's about 115 degrees sometimes in the summer, so having access to some kind of cooling is essential, and it's much cheaper. So it's a common form of cooling access in our area that's really water dependent. And being able to, having to not only do this as in terms of carrying water, being able to carry it in to meet your basic needs, and then also just having impacts on your costs for having to go to the laundromat, having to, often people would be using, in terms of impacts in the drought, people were using canned vegetables and things instead of being able to cook at home, so nutrition was impacted. There was really extreme stress on folks worrying about how they were going to be able to, what their future was like, how they were going to be able to meet their basic needs. And work was cut back often in terms of hours because of drought and the farm and farm fallowing. There was a lot of emergency with the drought. Unlike when there was toxic water coming out of the taps, when there was no water at all, the state started paying more attention. And so in 2015 through 16, California spent $148 million in emergency drinking water funding in Tulare County alone. much of that, unfortunately, was on bottled water and emergency tanks and hauling water to people's houses. And it took a long time for the state to be able to work on more permanent solutions, which is part of why East Porterville went close to 3 years without running water in their homes. So Community Water Center is the organization that I co-founded with Susana de Anda, my co-founder, about 11 years ago. We focus on acting as a catalyst for community-driven solutions through organizing, education, and advocacy. We've been working on the movement for water justice in California and try to ensure that those most impacted by water decision-making are driving those decisions and have a seat at that table. We work at the local, regional, and state level primarily, and really support community members to step into leadership roles themselves and talk directly and participate directly in decision-making processes to address the root causes of these challenges. So one of the big victories we had in 2012 was securing the Human Right to Water Act in California. So this is the first of its kind in our country. It basically just said that every human being has the right to safe, clean, affordable, accessible water adequate for human consumption and cooking and sanitary purposes, but is really written as a guiding principle for state policies, decision-making guidelines for state agencies. It does not create its own private right of action, so you can't sue to get water from your water provider, but it did really create a sea change and a foundation for an understanding in California that people didn't have access to safe and affordable drinking water, and that state agencies needed to be considering how their actions were furthering that implementation. You know, this is some of the group that of Agua in our office that was celebrating when this passed. It was many years of organizing and advocacy at the state level, a lot of grassroots mobilization and work with the faith-based community as well. There was opposition from the water sector, and you know, I think there was something I've reflected on a lot recently is that there was a strategy question for us about this wasn't as strong as ideally we would have liked, and so there was a question as to whether it was worth it to be pushing forward for something that was really more aspirational and setting a framework from which state agencies need to look at, even though it wasn't creating quite as much teeth as many of us would have liked. And I think, you know, what we came to then, and what I still agree with, is it's really what you make of it. You know, it's any policy is all implementation and how you use it and what the follow-up is. So the fact that we had so many people, the key is to make sure that all of those people are also part of moving forward the next steps. When we look at the human right to water, we see community power and engaged leadership as critical to addressing all, and to both securing the human right to water and to sustaining it. And that's really where Community Water Center is focused. But community power and engaged leadership need to be addressing, we see 3 major areas that we work on primarily. One is around resilient drinking water institutions. So in California, and this is probably true in other areas, there's either no institution at all that's responsible for providing drinking water. In the case of East Porterville, where Tomas lives, there is no water system. It was all individuals, and there was no centralized system. The county doesn't have the obligation, and basically nobody feels like it's their responsibility, and there isn't the technical, managerial, financial capacity in an institution in terms of, you know, full-time staff, collecting rates, and that sort of thing. Even where there are institutions, they're often very small and fragmented. The way that California's water governance has and water systems have developed is extremely fragmented. There are so many different kinds of entities out there, everything from giant municipal water districts and cities to some large privately regulated public utilities or investor-owned utilities. So there's some large systems that are privatized. There's a lot of large public systems, but there's often a mobile home park that is, or a labor camp that is its own water system. There's small community services districts, county service agencies. So there's, you know, you look at the water code of just different types of water governance in California, and it's huge, and they're all a little bit different. Some of them are really democratic, some of them, at least on paper, some of them are not. Some of them are landowner-based voting, so you have as many votes as you have land. And because, and they've grown up through really haphazard and racially discriminatory local land use decisions. So oftentimes, you know, a community of color or a farm worker camp that is just outside of town is kept separate from the city and never connected to the infrastructure. And so there's about 7,000 publicly regulated drinking water systems in California. I think maybe now a little bit less than that. The vast majority of those are very small and don't have, you know, at least in California, we use the technical, managerial, financial capacity. They often really aren't accountable to residents. Oftentimes there's no way of getting in touch with people easily to ask what's going wrong. And so one of the core things that we try to address is trying to create more resilient drinking water institutions that are accountable and able to reliably supply safe drinking water. We also look at funding access to ensure adequate infrastructure. You know, we really focus on the funding side because certainly there's an engineering side, there's a technology piece of that for infrastructure and treatment, and all of those are critical. But what we've found is really the limiting factor has been funding access, not just for the initial capital, but particularly for the operations and maintenance. So I'll talk about that a little bit more. And then source water protection and management. So nearly every water system in our area relies on groundwater. Groundwater, because it's not seen and because it's not really protected under our federal laws, has been unregulated. It's really kind of the Wild West in California in terms of groundwater pumping. It also wasn't regulated in terms of water quality for the major industries in our area. So when we first started, the most common contaminant was nitrate, and nitrate is primarily from fertilizer and manure. We have giant dairies in our area. And then sometimes, you know, septic or sewer in particular areas, but the vast majority of nitrate in the groundwater was from fertilizer and manure. And both dairies and agriculture had a total waiver of groundwater quality protections when we first started. So that's part of what we worked on, is building community power and engaged leadership from the communities most impacted to be pushing for changes in each of those areas. And I'll talk a little bit about how we've done that. But we really believe, you know, we're not going to get there. We're not going to get reliable access to safe, clean, affordable drinking water unless you have those most impacted not only pushing for that change, but then taking on engaged leadership to sustain that. So some of the policy tools that fit into these baskets I'll talk about, because that's a lot of what we do. We have made a lot of progress since 2012 when we passed the Human Right to Water. When we passed the Human Right to Water, right after that, there was one of the greatest things that did was just create more awareness at the state level with the governor who had to sign this, with media and with stakeholders, that this was even a problem. I think there was, just this thinking that California was great and progressive, and we don't have these kinds of issues in California. This is only an international issue. So over time, we've been able to build on that. We got the State Water Board. We moved the drinking water program over to the State Water Board, which basically meant that the same agency was regulating all the way from the source in terms of trying to protect water quality of rivers, streams, and groundwater to the tap for the first time. We also got a citation for the state, which had been sitting on hundreds of millions of dollars of federal funding in the state revolving fund, and not getting that out to communities. And so between those different, between that scandal and other pressure, we were able to move the program and consolidate it into the State Water Board, and then California has this industrial complex, I would call it, of passing state water bonds. It's big enough it's able to do that. I know that may not, and we have that mechanism in our state. That may not be true in other areas, but we were able to basically have the state take on debt to have just recently, close to $500 million in just for small drinking water and wastewater funding for disadvantaged communities. That's the term that they use in California. We were able to structure that so that 15% of that went to technical assistance. So specifically for nonprofits to work with local communities to develop feasibility studies, engineering, go to bid, actually manage the project. There were strong incentives for consolidations and making all projects have to look at consolidations. And all of this, that technical assistance was housed in this Office of Sustainable Water Solutions, which was kind of a center just of expertise, of funding. It's kind of a one-stop shop for funding and technical assistance resources just for small disadvantaged communities in our state. But it's under the State Water Board, which is housed the drinking water program and all the funding. We got that board to have significant new consolidation powers. So we have communities where they've been excluded from, there is a number of communities where they're just outside city boundaries. They actually got funding to redo their entire distribution system and connect to the city, which was right next to them, and had safe water. They'd gone a decade or more without safe water. It was all low-income Latino, primarily Latino community, and the city refused to connect them. They actually agreed and then went back on their promise because they wanted to use their water supply for new development that would bring in more tax revenue on the other side of town. And so one of the things we were able to do is get the state to have authority to actually force consolidations and say, if you have a failing system and the only feasible, they'll give, and the state is going to fund the solution, and so it's not going to cost that city anything, that the city basically can't refuse to consolidate them in. And there is about 6 months to develop a solution voluntarily. There's facilitation to see if people can resolve it themselves. But there is that backstop with the state, which has been really great and has resulted in about 30 consolidations just in the past couple years, whereas before that, I think there had been about 4 in the state for, I don't know, decades before that. So it has drastically, there hasn't been that many uses of that power, but just the threat of that power has resulted in a lot more consolidations voluntarily. And there's also a lot of incentives and funding for that. We passed the Sustainable Groundwater Management Act in California with the drought, which for the first time says that we have to actually achieve sustainability and pay attention to how much groundwater we're pumping. And there are new regulatory programs for dairies and irrigated lands, which our coalition of Agua, which has impacted communities in Tulare County, has been really the lead in getting those two putting pressure on both organizing, lawsuits, advocacy, and getting regulatory programs in place to protect against nitrates. And then in the wake of Flint and more awareness around and our report around schools and the impact on schools without safe drinking water, that the state, we were able to get funding at the state level for school access points, as well as a requirement that every public water system offer free testing to all of the schools that they serve as part of their permit. And there's just a few laws this year that are trying to strengthen those testing requirements as well. There remains a lot of challenges that we're still working on, even though we've made a lot of progress. We are really, I'm hoping, at the brink of really of a major advance in terms of addressing funding barriers. So even though we've been successful at getting hundreds of millions of dollars in capital funding, our communities, especially the small low-income communities, haven't been able to access that capital funding because either they haven't had planning resources, or most commonly, they don't have access to the operations and maintenance to be able to sustain a treatment for things like arsenic that are very expensive to operate. We also historically didn't, other than the drought response, we've almost never had access to emergency replacement water or interim solutions, and often the long-term solutions will take years, and in the meantime, communities and schools will go at years, if not decade or more, without access to safe drinking water, and it's our lowest income residents that are paying those costs. And then lastly, we're working on the state is working on developing proposals for a low-income ratepayer assistance program. I don't know if Greg Pierce is in here, but UCLA Luskin Center has been really involved in developing that, and I think there's a side event on this another time in this conference. I wanted to talk a little bit about operations and maintenance because we really see this as our as a major focus for us right now. The community of Lanier is kind of the case study of how helping people understand this challenge, which is that the community of Lanier had arsenic. It's about 600 low-income residents, mostly involved in farm labor. They were able to get a grant for $1.3 million for an arsenic treatment plant and built it. And then after a few months, found themselves in over $100,000 in debt, had to shut down the plant, and went into receivership, lost their community system, lost their safe water, and now don't have safe water, are paying higher rates because of the receiver, and still don't have safe water to drink. And that was really because they couldn't afford the ongoing operations and maintenance. Usually, because this was not funded through state funding source, which is why it was built, frankly. The state would not fund this because they require a feasibility study to show that you can afford that, but that means the most common thing is that these things are never built, and instead you go a decade or more without safe drinking water. And so that's why we have over 300 communities without safe drinking water, is this lack of operations and maintenance funding. And so we, this year, have a proposal. Well, it started last year, it's going into this year, Senate Bill 623. This is in the state level. In California, is a new safe and affordable drinking water fund. It would leverage the other funding sources that exist in our existing technical assistance program to cover those funding gaps, particularly operations and maintenance. It's aiming to raise $140 million annually with a diverse source of fees, including fertilizer fees, dairy operation fees, and a water user fee. You can imagine this is a little bit controversial with some folks, but there is widespread support, bipartisan support from the agricultural industry as well as many water systems, although the water sector has been really opposed to having any kind of water user fee. There is an exemption for low-income users, and one of the pieces of this is part of this package is improving our data and tracking of who doesn't have safe drinking water in the state. We right now have that portal, I showed the map before, that looks at the regulated systems, but right now we don't have good data on much systems under 15 connections or individual domestic wells. So we're getting, there's efforts right now to improve data tracking, and part of this bill package is to improve both the data tracking and management, but also doing outreach and actual testing in private wells in high-risk areas. There's a big push, and I think going to be even more legislation this coming year around consolidation and trying to create new forms of governance that would allow disparate areas to create more economies of scale by creating a kind of public district, so that there could be representation from all of these areas. It could be public, but you could have economies of scale that could actually have the technical, managerial, financial capacity to operate and plan. That's sort of a proposal we see coming up next year. But certainly this whole fund is aimed at not propping systems up necessarily, but moving them to a structure that will be sustainable. There's a lot of work in terms of implementation of the Sustainable Groundwater Management Act and agricultural regulatory programs, school testing and funding programs, and implementing the low-income ratepayer assistance program, which has not been established in our state yet, but there is a report coming out to look at what that might look like, what it would take, how it could be structured, and some of the large agencies, a few of them have programs, although there's very low enrollment in them. So that's really, that's really the things I wanted to go over. I think we really see that in order to secure any of those things, there needs to be a real diverse movement, particularly from the communities most impacted that are driving that and then sustaining that. We've helped residents like Sandra Garcia step into leadership roles. We have folks that have stepped into roles at the state level, the regional level, and their local water boards, and have a network of folks that we're trying to continue to support. There is real disparities just in terms of representation in our areas. For example, on local water boards, we're looking at this now to get updated numbers, but it was like 2% of the decision makers on local water boards were Latino or women. So it was pretty much all white men on these decision-making boards. To give you a sense, I mean, in general, our communities or our counties are majority Latino, but the communities are often more than 90%. And so it's drastic disparities in terms of representation and decision-making. And so, I think what I wanted to do was give some time to just hear from folks, both if you have questions, but also if there are things that are observations you have around similarities or differences in terms of other contexts. And please stay in touch. This is some of our contact info. So thank you. So any questions or observations, parallels or differences that you'd like to raise? Yeah.
and Matt's not only senior technocrats, it would be great to hear, the arguments you used, which are maybe not just that confrontational, which can work in some contexts, but often leads you down a dead end.
Yeah, the area that we work in is very conservative and Republican in terms of local decision makers. I know even just the word, the human right to water, was very controversial and put people off in our local decision makers. Less so at the state level, which is progressive in California. But so always looking at how we frame things. I will say one thing, I would say we tend to take a approach kind of from both sides. On one level, it was important for us to have community members be talking about the human right to water, because our local decision makers, when we were first starting especially, and even today, they often just say, yeah, it's brown, but you can still use it to make coffee. And that's just what it's like to live in a rural area. That's just what the water's like here. So stop complaining, basically. And so it was really moms organizing around and meeting with decision makers saying, the water in my kid's school, I'm worried about the water in my kid's school, and coming to testify at hearings saying that we're concerned we don't have access to safe water and everyone should have that. They might not have always used the word human right, but this idea that this is a basic need and everyone should be able to access this. We did a lot of organizing where there were community groups, so it wasn't just one individual that might be threatened. We have a lot of immigration status challenges, and so people have fear of retaliation. And so creating a community group that has a front that isn't just one individual was helpful. And then, definitely using media, but that's more on the, building kind of a movement and awareness for that this is an issue that needs to be addressed. On the other side, it's always helpful to be finding local businesses and kind of some of these both health and economic development arguments, as well as schools. So often school administrators that, they're having to spend their budget. They're not able to expand their business, or they're having to spend their school budget on buying bottled water when they would like to be able to use it to buy textbooks and things like that. So being able to bring diversified people in was really helpful. It's surprising. It's always surprising to me that, I guess it's not surprising, but we have, this should be such a non-controversial issue that everyone should have access to safe drinking water. And I think that everyone would agree that that's something that people should have and need. But because we're pushing for pretty significant structural change, it's always really threatening. I would say by far, we've taken on, agricultural regulation, some of these really big challenges. Having people themselves be talking and feeling empowered, so that it's not just an NGO or an outside group, but their own constituents, goes a really long way. So I think that's really our model. Say that again? What?
You can go to one of the owl mics when they ask questions.
Oh, great. Oh, good. Go to the aisle mics if you want to ask a question, if you can. Then we can get you recorded and hear you. Great.
Hi, I mentioned this to you before, but we have similar issues here in North Carolina, but in North Carolina we have these islands of historically Black communities that have been excluded from all municipal infrastructure. Some of them are islands completely surrounded by municipalities. Some of them kind of run up against the edge of municipalities. We have situations also where there are municipal service lines running right through communities that aren't connected or literally encircling them. And I've found sort of two challenges beginning to work on this here. One is when you raise the issue, it can really make some local decision makers angry because I think they feel like, gee, I'm pointing a finger and saying, you're all racist, but as a researcher, I'm just pointing out, well, I've found this statistically significant relationship between race in your neighborhood and access to community water supplies. And then I found high levels of contamination in some of these communities that rely on private wells and septic systems. So then people get angry and then they're not willing to engage with you. And I'm wondering if you'd counter that. And then second of all, like, to me as an engineer, the obvious solution is just to run a water line, like, right, especially if the water pipes are just circling the neighborhood. Why can't you just connect those houses? But it all comes down to money and who's gonna pay. And the argument that I get from local utilities is our bylaws don't allow us to charge our current customer base to connect new customers. And the households really don't have the resources to pay for this. There's very expensive one-time costs of connection. And many of the households are also, even if they would prefer to have city water, really worried that they won't be able to pay the water bill. So I'm wondering if you have any thoughts about financing and also working with local governments in a way that doesn't just get people really pissed off and, you know, shutting the door on you.
Yeah. I always, unfortunately, I think things always do come down to money to some degree. And I think I guess these two questions are related, and actually the one similar with the one before. I think so people once told us, and actually I think especially from working in the international sector, that we shouldn't try to both address, you know, source water protection and regulation of agriculture and these sorts of more controversial taking on big industries, as well as trying to get people access to safe drinking water and access to, because that would alienate people and that we should just focus on one. And we really felt like you couldn't separate the two, and that the people that are impacted by these water decision making, you know, they're part of the farm economy, they're part of the local economy. With local government, they're often going to the city schools, the city grocery stores. That's where often they have to go to the local post office to get their mail and things like that. And so I think there's always that's somebody else's problem, or you should keep that separate. And there is a way that I think it is important to bring up the things that they don't want to hear, and the things that make it difficult, but also understand that, you know, always focused on what we're trying to do here is ensure people have access to safe drinking water. And the only way you can do that is making sure that we have a safe source, that we have infrastructure, that we have adequate information. So, you know, I feel like we're always walking this very difficult line where sometimes we're pushing hard on local government and saying things that they don't want to hear, and sometimes we're really holding hands with them to be able to get resources into the area. I will say one really uniting thing, and one thing that has helped, is being able to go to the state and get state resources or federal resources to help subsidize local efforts, whether it's with the local utility or the county. And so being able to bring money in locally is always something that wins you more friendship and openness with local decision makers. That's really, you know, the issues that you're talking about in terms of who pays at the local level for connecting people in, you know, that is something that is a big driver in why we're trying to get this bill at the state level, and why we've worked on the types of funding at the state level for infrastructure to be able to pay for those costs, because it's not feasible. You know, there are cases where we have some water districts that are pretty wealthy, and they frankly could pay to hook up, you know, the local mobile home park. But you know, I think there's always a question about, at the end of the day, what's going to, can you move things faster if you bring in some money and help accelerate things? And so we've done that through, you know, these bonds at the state level, which have been able to pay for capacity fees as well as the infrastructure. And for operations and maintenance, we've we're trying to get this new funding source, and so that's an ongoing issue. Yeah, so I think, you know, I think it's always a challenge about how you don't shy away from helping people understand how we got here. I think it is important for people to understand that it's not by accident that there's some communities, that low-income communities and communities of color are the communities that don't have access to safe drinking water predominantly in our country, that there were really deliberate policies that led to that. But and frankly, there's still discriminatory decision-making that happens. But I also think really focusing on solutions and you know, trying to bring in additional resources always helps. Oh, yeah, maybe go ahead.
Yeah. Thank you. And also, yeah, I wanted to commend the work the CWC and you and Suzanne are doing. It's phenomenal. It's a really inspiring presentation. Quick question is, as you kind of laid out your next steps, what are some of the partners that you're looking to address maybe some of the gaps related to the data collection that you're, you know, as you're trying to navigate the next phase here? And another would be, what kind of advice or or what key elements would you share with other states that I mentioned that don't have a human right to water, don't even have or a map of communities that might be violating that aren't at the level of California, but definitely are addressing the same issues. I'm thinking of, you know, Mississippi and pockets all around the country that are also struggling with these questions. Thank you.
Great. Yeah, you know, we don't have, so California likes to think of themselves and ourselves as way ahead of the game sometimes, but that map it just came this year. We've been working for, I mean, it took us we were working for 10 years on this and passed the human right to water and passed many of these things without that. And we were struggling to get the state to embrace to create a map so that we could say how many people, we still don't know how many people in the state don't have access to safe drinking water, even in California. So I think the more that you know, certainly universities have been key partners for us in terms of utilizing existing data, raising up this issue, giving credibility to the, unfortunately, people discount community stories. But I think having anecdotal and real community stories along with the academic research and data and maps, especially if it's done in a way that is partnering with NGOs and community organizations that can use those maps effectively in advocacy, that's been really effective, as well as with media that put together a number of good maps and have helped raise the awareness on this. Media is really key, and finding good reporters and telling that story is really important. So I don't think and the other thing I would say is, even though we have this Human Right to Water Act, it's definitely helped and it's something that we've built on, but it's not like that's a magic switch at all. I think, you know, that's something we've been building as an awareness tool and one of the tools in the toolbox to advocate. But at the end of the day, what's really, I think, pushed things forward is building more of a diverse movement of leaders and raising the visibility, being organized to actually get into those decision-making rooms, not going away, and then finding leaders in decision-making bodies. So finding the staff and the agencies that are sympathetic and can work with you, leaders within the administration. We've been fortunate that we have more of those at the state level than some states do, or with local agencies. So being able to find those partners has been critical for accelerating things. I think we might be out of time, but do you want to ask one last question? Yes.
Hi, Laurel. You're not recognizing me. Katarina Albuquerque.
Oh my gosh! Yes. So Katarina was the UN rapporteur on the human right to water and came to Seville. Was a major turning point for us in terms of passing the human right to water, raising awareness of these issues, and
I just had a question.
Unbelievable.
Sorry.
No, I thank you for coming.
No, the question is, I'm sorry, I was at a meeting, so I couldn't be here while you were presenting, but when we talk about all these issues of lack of, and I was listening to somebody's question on how do we pay the bill and the disconnections and the affordability, etc., etc. And I remember, so when I was here on mission back then, I think it was 2011, and when I came back to visit Detroit, the problems were the same. And I know that the situation in this country is less favorable today as it was some years ago, the political situation. I know that. But I remember that one of the things that I think would enable better solutions and more fairness and better access would be to have a national affordability standard, that's what I meant to say. And I think this would, of course, enormously help help to have more fairness in the system, and also then enable people to get a right to some kind of a support or a social tariff or whatever, to have access to have access to water. So my question is, I think that you have to fight the fight at this level, but also at the more high level whatever. And my question is, has there been any progress in terms of these discussions of a national affordability standard?
Yeah, thank you. There is a bill right now in Congress that is looking at affordability and looking at developing some pilot projects. You know, I will say, and maybe this goes to other questions, is I tend to focus on where we think we can move things, and our National Congress hasn't been the place that I've seen the most movement and action. But I totally agree with you that part of that too has been that there has been, even when we had, you know, an administration that was more interested in certainly equity issues and access and affordability, there was, because we don't really have a national movement around water equity in the way that we should, there isn't as strong of a voice and push for that nationally. And so I think that's something I know some people are working on trying to build. They're trying to build more of a national caucus around that, to connect groups that are dealing with this throughout different states, because California is certainly not unique to this. On all of these issues, and especially with Flint and Detroit, and you know, many of the other areas on the East Coast that have done some really interesting things in terms of affordability and pilots. I think they're looking. There is more of a, certainly much more of a conversation, and actually some actual. Bills moving forward. I think, you know, and then one of the questions is, do you, you know, what is the role of EPA versus Congress? But I think overall, we just need to have more of a national space where people are working on these issues in the US. Great, well, I think we're out of time, but thank you all so much for joining, and I'd love to stay in touch.